Hello, everyone. Forrester Pack here with Your Healthcare Future, WFNU Radio 94.1. We're here today at CommonBond Community Headquarters for a great interview with Jessie Hendel. Jessie, thanks for sitting down with me today.
Sure, absolutely.
To discuss the intersection of housing and healthcare.
Absolutely.
All right, Jessie, could you please tell us a bit about yourself and your role with CommonBond Communities?
Yeah. Do you want me to tell you a little bit about CommonBond as well?
Sure.
Yeah, great. All right, so CommonBond is a owner of affordable housing communities across Minnesota, Wisconsin, and Iowa. We own and develop the community, build the building, the home for families and individuals, but we also offer supportive services and property management in all of our affordable housing. So I lead the services across the portfolio of our housing. So once someone moves into our housing community, my team of service coordinators work on site with residents on their goals with them. So we help people avoid eviction, we help people get jobs, we help people navigate the healthcare system. So I lead the team of staff that provides services in all of our communities.
Awesome. It's important.
Yeah.
And we want to discuss some ways that you or CommonBond Community staff have been directly involved in a situation where healthcare or participants' well-being was being directly and negatively impacted by their housing situation.
Sure. Well, there's really something we talk about in the field, and then that's the idea that having housing is a form of healthcare. So, we don't work with people who are actively homeless. We work with people once they are housed. So what we see with individuals is more the post-homelessness, so what they're kind of coming out of and what issues they have been dealing with as they're homeless. So we see individuals move out of homelessness who are coming into our housing with chronic conditions, maybe diabetes, that they haven't been able to manage for a number of years because they've been unstably housed. So when someone doesn't have that stable platform, it's really hard to get quality health care and manage your health and well-being. So we see once people move in with us, we're working with them to establish primary health care connections, get them going for a physical, help people manage their chronic conditions, get a care plan developed. So we really see people stabilize in their health and well-being once they have that stable foundation.
So it's almost like a coaching role, a partnership role that you continue with the participants as they go through.
Yeah, yep, absolutely.
Sorry.
The other thing I would add is just we hear over and over from residents we serve how hard it is to access services in general, including healthcare, when you don't have an address. You might not have a phone number. So to have a primary care clinic where you can get reminders sent to, where you can get mail sent to, when you don't have a permanent address in a home, having those kind of connections to systems can be really difficult. That's one of the reasons people probably rely on the emergency room more when they're homeless. Once people are housed, we're able to make those more consistent connections to care providers, and they're able to follow through with them.
CommonBond Communities has helped 767 households regionally across Minnesota, Wisconsin, and Iowa, and you've helped participants avoid and prevent evictions. Is it fair to say that money, time, and resources saved for these families could go into them focusing on their collective health care?
Yeah, I think that's generally the idea. When we help an individual or family prevent eviction or housing instability, there are numerous benefits that individual or community gets. When you have that stable housing platform, you're not focusing every day. Your primary concern isn't where you're going to stay tonight. When you have that stable housing platform, you can focus your time and resources and energy on things like health, well-being, employment, other goals you might have. So we see that by preventing housing instability, we're able to continue to support families with that stability that allows them to work on other goals. We recently heard a story from one of our team members of a resident who moved into one of our buildings after being homeless. And when she moved in, she was very withdrawn, couldn't really or wouldn't really speak. She was in very poor health. She was just really, I think the sense was she was really drained. After a few months of housing stability and support from staff and not kind of having that constant stress and pressure of homelessness and wondering where you're going to sleep, she now, I guess, is interacting, connecting with neighbors, even hosting community events in her home. So just seeing where she's come in a few months, I think, is an example of the importance of stable housing on health and well-being overall.
Yes, the stability, I can see it there with the mental and emotional awareness being a factor too. Like, not necessarily always just physical, what we see, but what we deal with spiritually, emotionally, mentally.
Yeah, I mean, being homeless or not having a stable home to live in, I think, is well known to create a chronic sense of stress for people. And that stress is not good for us. When we talk about chronic stress in populations not related to housing stability, but other kinds of chronic stress, maybe work stress, how poor that is for your actual health and well-being. And that's the same here, that being homeless creates chronic stress for people, and it has significant impacts. I think there's some research on kind of the length the decreased life expectancy from people who are in a high level of stress or high level of trauma has on people. So that is a huge impact we need to be aware
of. Within the last month, we've experienced the typical yet dangerous introduction to Minnesota winter, with our nighttime temperatures falling below zero.
Yeah.
I know CommonBond Communities works more with tenants in their homes rather than homeless on what we might see on the streets or what have you. But maybe anecdotally, have you seen or heard examples of citizens that were suffering from the colder weather that was just introduced?
Yeah, we do have a few properties who that are intended for people moving out of homelessness, although it's not the majority of our work. Of course, it's very dangerous to be without a home when it's this cold. Luckily, there are many local service providers who are providing shelter and safe and warm space for those community members. I think that they carry a huge amount of burden, and really what we need to figure out how to do is just not have that happen, right? Not have people be homeless in Minnesota in winter or summer or spring or whatever. And really it's about what's the root cause of that. In a lot of ways, this root cause of people being homeless anytime in Minnesota is there's just not enough affordable housing. People cannot afford our housing stock in Minnesota.
Absolutely. All right.
Yeah.
What are some ideas or solutions that you and the organization would like our lawmakers to try to tackle with the twin issues of lack of housing and lack of health care? And as we discussed, how they're intertwined.
We'd like our lawmakers to really focus on increasing the supply and production of housing that's truly affordable to all of our community members. While we see that the impacts of a lack of affordable housing, there's a huge impact of affordable housing on health of our communities. Really, if we just increase the supply of housing, that will solve a lot of the problem, right? So housing is healthcare. So we'd like our lawmakers and all of our community members to continue to stay really focused on how to create more housing in our communities. And it's really in all communities. It's how do we have equitable access to affordable housing in Shakopee and Eden Prairie and Minneapolis and St. Paul and Oakdale. So that production, I think, of new housing is super important. And it's really, ensuring the affordability, because we can create all the new housing we can build, but if it's not affordable to teachers, to store managers, to bus drivers, to kind of the whole continuum of who lives in our communities and who our neighbors are, we're still going to have these problems that show up in a really visible way, like homeless encampments, where that was a very visible demonstration of a problem we've all known is there in our community about affordability and lack of access to housing, particularly for people with barriers. But we really have to up the supply.
Wow, it's a great point. Did you have any calls to action or closing comments that you would like our listeners to know and hear?
I think one of the most important things to us is, people will get involved in policy advocacy in different ways according to what they're interested in, how they see their space. But we would ask your listeners to be thinking about having this conversation when you're at dinner tables, having this conversation when you're at community events, thinking about when a new affordable housing community is going to be built in your community. How do you show up and learn more and figure out how you can support that affordable housing community? There's still a lot of folks who express a lot of negativity about new housing being built in their communities. So think about how you can help welcome new community members and learn more and be helpful and kind of help people get over some of that fear that they express, and learn more. Think about what access would mean to your neighbors to that housing and figure out how to help. And each of us have our own way. I think that we get involved in these important community issues. It might be going to a homeless day on the hill. There's a homeless day on the hill event that comes up in the spring where folks who advocate for more housing for individuals who experience homeless show up to advocate in front of lawmakers. That's one way to get involved. But I think also getting involved means saying to your neighbor, hey, did you see that thing that is being built? Let's go to the public meeting and learn more.
Yeah. And this is critical advice because, as we had been talking about, it goes beyond housing. It's your health as well. Our individual health is on the line in situations like this. So if we're more cognizant of how we can help each other in our community when it comes to housing, you'll not only help the housing, you'll help the healthcare, and you'll help the state overall, I think.
That's right. Yep. The state will do better if everybody has a place to sleep at night.
Absolutely. Well, Jessie, thank you again for sitting down.
You're welcome. Thank you. Good to talk to you.
Thank you.
Take care.
Too. All right.